So what a urogynecologist is it's a doctor who primarily deals with pelvic disorders from the bladder down, so also dealing with disorders of some of the rectum, but more with control of the bowel issues, as well as vaginal support issues. So pelvic organ prolapse has a lot of different names. So some people call it a cystocele, which is basically a bulge of the front wall of the vagina, and on that other side is the bladder. So that's why it's called a cystocele. It's basically a relaxation of the support of the bladder. Some people call relaxation of the rectum into the vagina a rectocele. So that's another name or terminology that people may hear. And then uterine prolapse is actually when the uterus falls down, as well as vaginal prolapse is when the top of the vagina falls down. Basically, all the pelvic structures are supported by ligaments that attach it to the bony pelvis, and then those can be torn by either things like repetitive straining or lifting, but most commonly with childbirth is usually, for most women, the major inciting incident. And then as they get older and their pelvic floor muscles, which line the bottom of the pelvis, also relax, then these conditions can become more evident. You don't have to have treatment. So again, this is a quality of life disorder. Patients usually come in because it's bothering them. But one part of my job is to really reassure patients that this isn't dangerous, this isn't life-threatening, but there are things that we can do to help. The hard thing about pelvic organ prolapse is there's basically only 3 treatment options. Number 1 is to do nothing. Number 2 is to use a pessary. Number 3 is to do surgery. Pessaries, which are basically vaginal support devices that we fit for the patient. So it's kind of like, I liken it to fitting a shoe. There's a different size that fits everybody, and so sometimes you have to try on a few to find the right size. There's all different ranges of surgeries. The nice thing is most of them can be performed in a minimally invasive way, so either performed through the vagina with minimal or no abdominal incisions, or using a laparoscope where you just have 4 or 5 tiny incisions on your abdomen, which is nice for the patient because it allows them to feel better sooner and have a quicker return to their usual activities.